Thank you, Mr. Speaker. I have the honour to present a message from His Honour, the Lieutenant Governor.
The Lieutenant Governor transmits herewith Bill number 23, Int'l Public Health Act, and recommends the same to the Legislative Assembly. Minister.
Speaker, I move that Bill 23, the Public Health Act, be introduced and read a first time now.
Honourable members, you've all heard the motion. All those in favour say aye. Aye. Those opposed say nay. Motion carried. Minister.
Thank you, Mr. Speaker. The new Public Health Act creates a modern legislative framework establishing the tools and provisions necessary to fulfill the commitments for a healthier British Columbia outlined in our recent throne speech. A few years ago, Mr. Speaker, Canada was affected by the global SARS outbreak. BC was remarkably well served by our public health officials during that incident. However, it brought to light across Canada the need for increased vigilance to global public health risks. This legislation provides public health officials with the tools to quickly and effectively mobilize public health initiatives to address these global threats. Mr. Speaker, if governments across Canada are going to address the sustainability of our public health care system, we need stronger tools to support health promotion initiatives. More than 1.3 million people in British Columbia suffer from one or more chronic conditions, and over 90,000 people suffer from 4 or more chronic conditions. While these individuals represent 34% of the BC population, they consume 80% of the combined MSP, pharmacare and acute care budgets. Addressing this challenge is fundamental to the sustainability of our healthcare system for the future. While our government has already taken steps in addressing chronic diseases, we know there's much to do. We'll use the tools established by the new Public Health Act to ban the use of trans fats in the preparation of foods in schools, restaurants and food services establishments by 2010. And through the tools in the Public Health Act, we will be better placed to continue to make further investments to address chronic disease. Safe and healthy communities are another goal of public health and of this government. The new Public Health Act will address government's throne speech commitment to require communities to include provision for mental health and addiction service facilities in their community plans. The new Public Health Act is an important addition to our legislative toolkit that we hope will serve the people of British Columbia for the next 100 years. It is also a reflection of the fact that addressing public health issues is a job not only for the provincial government, but for local governments and for individual citizens themselves. Mr. Speaker, I move that the bill be placed on orders of the day for second reading at the next sitting of the House after today.
Honourable members, you've all heard the motion. All those Honourable members, you've all heard the motion. All those in favour say aye. Aye. Those opposed say nay. Motion carried. Mr. Clerk.
Statements.
Member for Victoria Beacon Hill and the Leader of the Opposition.
Thank you, Mr. Speaker. This month, communities across BC will be celebrating
legislation which will provide tools to address the public health challenges of the 21st century. This new Act has been in development for over 4 years. It's been built on the foundation of numerous consultations and dialogues, the input of health professionals and community leaders. It also reflects the needs and interests of all British Columbians. During the recent conversation on health, we heard strong support for more proactive measures to promote health and prevent diseases, disabilities and injuries. And that is the main purpose of the new Public Health Act, to provide public health officials with the authority to take action and with direction to promote and protect the health and well-being of British Columbians. These directions follow and build upon the solid, proven foundations of programs such as Act Now BC. Through Act Now BC, government has helped British Columbians to create over 150 active community plans, encouraging people to become more physically active, helping to reduce the risks from heart disease, stroke and diabetes. And in the government's recent throne speech, we continued to move in that direction, setting a number of public health priorities, such as the banning of trans fats in the preparation of foods in schools, restaurants and food services establishments by 2010, encouraging more healthy eating and addressing the roots of chronic disease. We have also increased our efforts, Madam Chair, to improve nutrition with an expanded school fruit and vegetable snack program, enabling our children to do their best both physically and academically. Some of the specific ways in which the new Act will address the future public health of British Columbians include allowing the Minister to require development of specific public health plans, updating powers of inspection and powers to issue orders to address health hazards, modernizing provisions related to examination, treatment, quarantine, and isolation of people who pose a threat to public health, and by improving access to mental health and addiction services in our communities, helping a vulnerable population to begin the recovery process and avoid other significant health risks such as hepatitis and HIV. Many Conversation on Health participants also called for a stronger public health voice on environmental protection and a strong, robust system to address infectious disease outbreaks. The new Act will address these challenges by providing a regulatory framework to deal with activities that cause health hazards or that adversely affect the health status of the population, by increasing the ability to collect information of public health importance while protecting privacy, by enhancing public health emergency responsibilities in accordance with the best practices set out by the World Health Organization, and by expanding the reporting of communicable diseases to indicators of health hazards like lead or mercury poisoning. We also heard calls for better access to immunization services and for greater public involvement in the delivery of health promotion programs. The Act provides for, enhancing collaboration between health authorities and local government, creating comprehensive abilities that enable the Act to serve as a useful and flexible tool, and developing specific public health plans to address issues such as potential infectious disease outbreaks like West Nile virus, and dealing with more chronic conditions such as diabetes, alcohol, and drug problems. The Act also ensures local public health officials will continue to have the powers necessary to investigate health hazards, monitor compliance with the Act, and in fact, these capabilities will be strengthened within this new legislation. Health officers will be able to issue orders to groups of people to take appropriate measures to control a health hazard, instead of the present need to issue specific orders to each affected individuals. New provisions within the Act will also allow decisions and orders of health officials to be reconsidered and reviewed, providing fairness and balance to the process. As well, a number of older pieces of legislation, including the Health Act, Venereal Diseases Act, and Public Toilet Act, will be combined and updated. The new Act will also maintain the current roles of the Provincial Health Officer and Medical Health Officers in health promotion and protection. It provides clear authority for medical health officers to direct the public health response to local threats, and the public health officer to direct a provincial-level response to a widespread threat. The Act will clearly establish the powers and duties of the Minister and public health officials for public health monitoring and reporting, communicable disease control, environmental hazard response, chronic disease and injury prevention, and public health emergency response. This new Act will make a difference to the current and future health, safety and well-being of all British Columbians. It will provide the tools we need to face present and emerging threats from disease, natural and human-caused health hazards. It will enable us to take strong, positive steps to support healthy lifestyles, healthy living conditions, and healthy communities. Madam Speaker, a few weeks ago, I asked the Provincial Health Officer how long in coming this Act was. His response was that there were requests for legislation in the 1990s and in the 1980s, but they never went forward. And I think, Madam Speaker, this shows the concern on this side of the House with the modernization, improvement, enhancement of this Public Health Act. Governments have had decades to modernize public health legislation, to put in place stronger tools to address preventative health initiatives and the growing burden of chronic disease. Previous governments made a choice and chose to let the growing burden of chronic disease continue to attack the sustainability of our public health system. We're taking action as a government to provide more tools to address the burden of chronic disease and the sustainability of our health system. And, Madam Speaker, I'd be remiss if I didn't address the NDP health critics' recent comments that the ban on trans fats in the preparation of foods was actually an NDP idea. My staff checked Hansard, looked at estimates debates over recent years with the President and previous health critic, looked at private members' bills, and looked at their caucus news releases. And, Madam Speaker, since I've been Minister of Health, the NDP has not stood up on any occasion in this House and advocated a ban on trans fats. We're well aware, Madam Chair, We're well aware, Madam Speaker, that an NDP MP from Manitoba has been pursuing this initiative in Ottawa, but it is a little much for the NDP to take credit for an initiative undertaken by a federal member of Parliament for Winnipeg. Nonetheless, Mr. Speaker, I do hope that members on both sides of the House lend their support to this worthwhile and very necessary piece of legislation, and with that, I'm pleased to move second reading.
Thank you, Minister. Member for Vancouver.
So the Minister of Health speech is when he diverts off what's been provided by his staff and gives us his flights of fancy. I was going to recommend one particular website to the Minister of Health just at the start of this, which is called google.ca. Yeah. And as he knows, you could actually probably pick up Mad Magazine by going to google.ca and getting access to that. Then he'd be able to see that these proposals on trans fats, of course, came from the NDP. Not that we want to claim credit. Legislation, one that, because of its very nature, we'll be spending more time at committee stage and at second reading stage in dealing with. What we're talking about for people watching the debate is a bill that runs to approximately 126 sections, 92 pages, 10 parts. And a lot of that, Honourable Speaker, is essentially a part of existing legislation. Some of it's amended, some of it's not. And so the bill is a general bill to consolidate previous public health bills, such as the Health Act, and it includes, as the Minister suggested, changes to and the elimination of some pieces of legislation or the consolidation of some pieces of legislation, such as the Public Toilet Act. Honourable Speaker, I want to talk a little bit because, you know, we're living in a time where I think our understanding of health policy issues and the fact that health policy issues are not confined to hospitals or to doctors' offices, but that they have a broader I think, a broader importance and a broader, and that other issues outside of what you'd call the healthcare budget or the healthcare system have a profound difference on public health. You know, Honourable Speaker, for me, I learned this in a personal way because, as I've mentioned before, members of this House, I'm a type 1 diabetic. I was working in this building.
Legislation provides for openness, accountability and transparency. And it is with that, Madam Speaker, I wish to conclude my remarks and thank you for providing me this opportunity to give these cautions with regards to Bill 23, the Public Health Act.
Member from Maple Ridge Pitt Meadows.
Thank you, Madam Speaker. And I take my place to join in the debate on Bill 23, the Public Health Act. And as has been mentioned by some of my colleagues before me, Madam Speaker, there are things about this Act that I find quite acceptable and want to support. For example, the legislation fulfills the government's throne speech commitment to ban the use of trans fats in the preparation of foods in schools, restaurants, and food service establishments by 2010. The legislation in itself does not ban trans fats, but enables the regulation of health impediments. So, Madam Speaker, insofar as those are effective, and I'm sure, well, I'm hopeful that they will be, I certainly endorse that move by the government. I think it's being clearly understood, and there's all sorts of evidence and research to support the fact that trans fats are not good for our health. And I know my wife keeps close track of the trans fats that Bill. The general purpose of Bill 23 is to enable medical health officers and environmental health officers to investigate health hazard complaints. It supports preparations and responses for public health emergencies and ensures that government and health officials have the authority they need to mobilize resources and take action to protect public health. It provides the Minister with new powers with respect to requiring public bodies, including health authorities and local governments, to develop public health plans to address emerging health issues. And my colleague, the member for Caribou South, who was up before me, mentioned some of his concerns around local governments and this act. So, Madam Speaker, I won't delve further into that issue other than to note that it's been brought up by my colleague. The government says the bill completes modernization of the Drinking Water Protection Act and other acts. And I will, in a few minutes, Madam Speaker, talk a little bit more about the Drinking Water Protection Act and require that a public health plan be made to monitor factors including public health. And the Minister sets the terms of reference for the plan, including who must be consulted. So, Madam Speaker, I want to talk a bit about, in fact, probably most of what I have to say today, about the protection of drinking water, which is a truly essential part of protecting public health.
Speaker, when you compare that the regulations are going to be developed by Cabinet in secrecy, I challenge that this particular legislation provides for openness, accountability, and transparency. And it is with that, Madam Speaker, I wish to conclude my remarks and thank you for providing me this opportunity to give these cautions with regards to Bill 23, the public health.
Shall Section 126 as amended pass? So ordered. Shall Sections 127 through 161 pass? So ordered. Shall the title pass? Member.
I just on the title, I know the Minister would want to do this, that this kind of legislation requires just enormous amount of work over a period of years. I think the Minister will acknowledge this, and just to congratulate particularly the staff, in this case, who worked on this process through that time. I know a lot of consultation, a lot of work goes forward. This is very important legislation, not controversial in the usual way. First one, I just wanted to congratulate the people, all of the people who contributed to this process, and I'm sure the Minister would like to do the same.
Minister.
Thank you. I appreciate the member's comments very much. The member's right. There's been an enormous amount of work that has gone into the preparation of this Public Health Act. When I became the Health Minister about 3 years ago now, work was underway with respect to a renewed new Mental Health Act for the province of British Columbia, and I think the work had been in progress for years before that. So I do want to thank Dr. Emerson, Dr. Kendall, and the many folks in the public health section of the ministry for all the work that has been undertaken, and as well the many capable officials in the Ministry of Health who have assisted with that process as well. But thank you to the member for his comments.
Shall the title pass? Aye. So ordered.
Committee Chair? Oh,
Mr. Speaker, I move the committee rise, report the bill complete with amendments.
Members, you've heard the question. All those in favor say aye. Aye. Opposed, say nay. The motion is carried.
Committee Chair.
Mr. Speaker, committee rises, reports Bill 23, Public Health Act, complete with amendment.
When shall the bill be considered as reported, Minister?
By agreement now, Mr. Speaker.
Honourable members, is agreement third reading? Honourable members, the bill is third reading on the Public Health Act. All those in favour say aye. Aye. Those opposed say nay. Motion carried. It's an act, Public Health Act. Government House Leader.
Thank you, Honourable Speaker. I call committee stage debate on Bill number 25, the Health Professions Regulatory Reform Amendment Act 2008.
Committee Chair.